Now, currently out at the VA, we do use this ACRIN tagging protocol, and we were one of the sites for the ACRIN trial. And this looks very busy and a difficult prep, but it's not that bad. It consists of 2 different tagging agents and a cathartic. So patients have to remain on a clear liquid diet on the day before, and during the morning on the day before, they will take aliquots of Tagatol, which is this heavier or higher density barium product in 3 different aliquots. This is used to tag the solid stool in the colon. And then in the late afternoon, the laxative is given, followed by bisacodyl or Dulcolax tablets, which is just another form of a laxative. And then finally, in the evening, on the night before the CTC, the patient will ingest 3 different aliquots of gastrografin or the iodinated contrast material. And this is to tag any residual fluid. So there is actually thinking that went behind developing this actual protocol, which is the barium product tags the solid material, and then you have the evacuation in the late afternoon. And then anything that's residual is usually fluid, and the iodinated contrast actually tags that very well. And so we've used this for many years, and it works quite well. And this is just an example where, to the untrained eye, you might not be able to pick out the particular polyp, but with tagging and then using electronic or digital subtraction, you can see that the polyp really stands out.